So we know that the COVID-19 pandemic has not been easy on anyone, but especially kids. You know, throughout the last 2 years, we've talked a lot about the depression and the anxiety. And today we're going to talk about something we can actually do about this. Denver Departments of Public Health and Environment is going to be hosting its first Youth Mental Health Summit. Rick Padilla is here to join us to talk about this. I appreciate your time. I just wanted to start off with the motivation behind this summit. What are you hoping to achieve?
Well, thank you for having me this morning. I very much appreciate that. Really, I think the objective of the summit is to give hope and provide a platform for young people across the metro area to speak their truth and have some outcomes that we can really kind of put some resources behind to address youth mental health from a youth perspective.
You know, and this is personal for you. You've brought a couple of examples of ideas that have come up. Can you tell us the story behind that?
Oh, absolutely. So we lost our son, Jack Padilla, on February 14th of 2019. He was a freshman in high school. And Jack was a very popular kid. He played lacrosse across the metro area. And when he passed, a number of his friends came to our house and they said, "Mr. Padilla, we need to do something." I said, "Okay, 2 rules. You put your phones away and you participate." They sat down, about a dozen of them, and they came up with 11 ideas. And this board represents those ideas that the young people came up with. And they range from testifying in the legislature, creating and speaking at schools. Last June, the governor signed Jack and Kate's Law. That was number 10. And number 11 is the Youth Summit that we have coming up Monday.
Wow.
So I really look at that. I provided the infrastructure. Those are their ideas. They're the ones that have accomplished all these things, and I'm very, very pleased with it.
Yeah, what is that like then, to see that they came together and said, we have to do something, and now it's coming to fruition?
It's really heartwarming because young people are talking about their mental health today. And I think we as adults have not been as honest with ourselves and having the discussion. So I think really what's heartwarming for me is young people are saying, we need to talk about this. We need to do something. Here's some ideas that perhaps you as adults can help us accomplish.
Yeah, and at the summit itself, what is going to be happening there?
We have a full day of events. We're going to have some opening sessions, music. Young people like music, and we want to get them attracted, breakfast and lunch. But we have 5 breakout sessions where we've worked with all the healthcare agencies throughout the metro area, and a youth board came up with the ideas for the breakout sessions, ranging from dispelling myths around suicide and mental health, to QPR, a question, persuade and refer. Just had a number of workshops. We have parents coming, young people coming, caregivers, and we're going to do meditation, teach kids non-traditional coping skills, and we're documenting the entire event in hopes that what comes out of that 3 or 4 ideas, we're doing some data analysis that we can identify programming for young people and put resources behind that and say, all right, these are your ideas.
Fantastic. Some of the smartest ideas come from our youth, you know. So if somebody wants to participate, if they want to come to this, what can they do?
Well, I think 2 things. They can go to www.denvergov.org/we got this, or they can register on site as well.
Yeah, that is absolutely beautiful. Not too late to get in and join, right?
Not too late. We have budgeted enough for a number. We have a few more seats left. We'd love to see more people.
Remind people, date and time.
May 2nd, 8 a.m., University of Denver Ritchie Center.
All right, there's going to be some powerful and beautiful things that come out of that day. Thank you so much for coming on and sharing.
Thank you so much for having me.
All right, we'll be right back.